Hello. Yes. Good afternoon, everybody. I'm Dr. Sonal Saste, consultant pediatrician at Surya Hospitals here at Santa Cruz, West Mumbai. So today I'm going to talk about the most prevalent topic, which we are right in the middle of it, the monsoon-related diseases. So firstly, before I begin the session, it's a proud moment for me. I'm a part of the pediatric department here at Surya Hospitals in Mumbai, which has recently won the first ranking in pediatrics department, the Mumbai and West Zone. So kudos to my entire team here at Surya Hospitals and pediatric department. So today we're going to begin talking about monsoon-related diseases. So first, I'm going to give you a brief up about how this monsoons affects our health and our mental health as well as physical health. So mentally, it's a huge respite because we get relief from the sweltering heat, and it's a good scenery to look around, greens. We wish to go for trekking, for excursions, and a lot of fun-filled activities even for kids. But along, unfortunately, we see that there are a lot of monsoon-related illnesses, a plethora of diseases. So the commonest diseases, what we usually experience is what I'm going to talk to you about and brief you about. So the common thing, let's begin about that how the monsoon changes the plot. What exactly happens in monsoons? So monsoon is actually, if you check, is derived from the word mosam, and it is actually for us as Indian, it's the southwest winds that come along. So we have experienced that there's a big breeze which come around. So there's definitely changes in the temperature that we see. There's a lot of increase in humidity also which comes along with it. And how does it affect? Because this is very conducive for the germs to proliferate. They thrive better and they grow even more. So that's why we see diseases also increasing along with it. Also, what happens, because especially if we are in the low-lying areas where the sewage and the potable water can get mixed, so there is contamination of this water. So because of which the drinking water that we consume, if it contains germs, we get the gut-related infections. In fact, if you have recently checked and you're reading newspapers, we have sensed that there has been outbreak of gastroenteritis. Also, the parents, now everything is on WhatsApp groups. You may be getting intimation that there are even few hand, foot, mouth diseases, even influenza-like illnesses. So this all comes as a part and parcel of monsoon. But there are definitely some things that you can keep it in check, so that we are not inviting these uninvited guests at our home. So what can we do to protect against these diseases is what our topic is essentially going to be about. So like I told you, the source could be the water, the food because of contamination, also the food because of the flies. So we see this is what we call as the fomite spread. We see that there are a lot of insects, flies which sit on the food which is not being covered, water which is not being covered, and hence we get these bacteria which rapidly multiply once we consume these food items. So what are the common waterborne diseases that we see? Commonest is diarrhea. Mostly this is viral, so it's usually self-limiting. But let me tell you and emphasize, diarrhea in infants is the number one cause of infant mortality rate. So let's protect our little ones because they have very less reserve. And the biggest pitfall on getting diarrhea is you get dehydrated. And in very younger kids, if they lose excess of weight, then it could be even critical for them because it's just not the water loss, but also your sodium, potassium, which can go in a different direction and can affect the child's health. So hence, ORS, you need to seek your pediatrician's help and accordingly take the necessary treatment along with ORS, which are readily available. So I'll be talking about diarrhea more in detail, what are the red flags, but let's even talk about the other diseases, which is fecal-oral bone, which is like typhoid fever, leptospirosis, cholera. So all these diseases are foodborne and waterborne. So you have to keep it in mind that what are your red flags before you reach out to a doctor. So usually any fever that comes in typically would last for about 24 to 48 hours. As the end of the second day, you'll experience your body kind of takes over and the fever starts on a declining trend. So the requirement of giving paracetamol, oral drops or tablets considerably reduces. What you also see that the child who has been eating less, drinking less, will have a experience in a change in the appetite. So you need to make sure that the child after 48 hours is more active and demanding more food. You should make note that the child is not passing blood in the stool. So that is also one of the red flag signs, because this could also mean that there is some parasitic infection. So basic, what are the red flag signs where you need to reach out to a doctor? Fever for more than 48 hours, blood in stools, a lot of mucus in the stool, very large quantity watery stools, that your child is not able to cope up with the losses. So if he's not drinking well, there is decrease in the urine output. And if you feel that the child is definitely listless and not active. So these are points where you need to reach out to your pediatrician. So talking about ORS, so in the market you get readily available nowadays. There are different flavors ORS, like electrol water. You have apple flavor, mixed flavor. So you should encourage child to have ORS rather than just water, because like I just told you, because you need to have certain sodium in that particular water so that your water from the intestine is absorbed and child doesn't just lose water. So these oral rehydration solution, which is ORS, are specifically designed so they are more gut friendly. So you get it in the pharmacy as well as you can make it at home. So making at home involves like you have to take a liter of water, you have to add 6 spoons of sugar and 2 pinches of salt. So that is the homemade ORS, which also you can do. There's certain diet that you need to follow, like going a little dairy free, consuming starch based diet, like rice kanji, arrowroot kanji. So these all are more gut friendly food items, which definitely works in case of diarrhea. So diarrhea, the common organisms, like I just told you, is so I think in the meanwhile, I can take 1 or 2 questions before I begin my next topic. What food should be eaten during a monsoon? So that's a very valid question. So the foods that you can eat is usually which are with cover. So bananas, apple, if you peel off the skin, is good. Very ripe, like, fruits should be avoided. Like mangoes, definitely in monsoons, you should avoid. Apple is good. Pear is good. So coconut water is excellent. So definitely you need to hydrate yourself with these kind of fruits and fruit juices. Naturally made fruit juices, not from Tetra Paks. Then I think now I'll move to the next topic, which is also monsoon related, which other than waterborne, we are talking about the airborne diseases. So with the change in the wind, the southwest winds, we see that there are also, because of the drop in the temperature, certain viruses like influenza virus and all thrive better in these temperatures. So we have seen spike in influenza-like illnesses. So if you check, influenza virus would have nearly the same symptoms like any respiratory virus, like even for that matter, COVID fever. So unless you run the test, it's really difficult to make out, is it influenza virus or is it some other respiratory virus? But yes, in adults, what you will see, the older kids and adults would experience more severe symptoms, like a lot of body ache, lot of headache, lot of throat pain. So, what we call in medical word is a prostration. Your child is really sick for those 2 days. And as the 3rd day comes, then the child feels a little better. So these are the common illnesses that we experience airborne during the monsoon season. Then also speaking about vector-borne diseases, like because of course, usually that doesn't happen during the monsoon period, but when this water starts collecting and it's not free flowing, the stagnant water is a breeding ground for mosquitoes. So malaria fortunately has been less for this last 2 years because we have clearly keeping in check, we have been very careful on the hygiene parameter, but we have to be careful this monsoon because now, the construction is back to pre-COVID time. So we see a lot of collecting pools and ponds. So you should make sure that the government and the BMC is definitely doing their bit, but we have to make sure that there are no man-made pools, like, so your pots you consider, the tires, or even in your own society or, the premises, that there is no collecting pools. So if there are, you need to empty it and accordingly make sure that you're notifying the BMC so they can put some mosquito, repellent, like an oil film, they keep it over so that the larvae and all don't breed. Besides your personal protection from mosquitoes would be like putting anti-mosquito repellent sprays. So there are pharmacological ingredients like beet, which can be used as a spray, which you get even in a form of a lotion. And secondly, you get citronella oil or even eucalyptus oil mixtures that you can use on kids. So these are again safe and protective, but you need to repeat it every 6 hours. It is not that one application will last you for 6 hours plus. So keep it in mind about these things. Also, somebody is asking me about what clothing to wear during monsoon. So this is very important because, especially you want to take the child downstairs for playing in the evening. So typical mosquito biting time is the dusk and dawn. So during this period, you have to be careful that the child is covered, especially hands and legs, with pastel color clothes rather than making him wear bright color clothes like red and fluorescent should be avoided. Pastel colors you can make them wear, and you can put, nowadays you get those mosquito patches which can be definitely safely used, but make sure that the child is not of an age where child is plucking out and putting things into the mouth. So we don't want it to be like an hazard for the child, especially a choking hazard. So then second part is protecting yourself from mosquito bites during the dusk period by putting mosquito nets. So you get those nets with particular millimeter strength, and even during bedtime you can put it, and those are generally safe for even infants. So that is another way that you can protect. Then we can talk about, yes, the diseases, dengue, malaria, and chikungunya. These are the common diseases that we see in Maharashtra, which are vector borne, which is mosquito borne. Dengue, now these are typical daytime mosquitoes. They would bite. So typically we say dengue fever is the one which, you would get up from a mosquito bite from your workplace or your schools. So that's because mosquitoes are daytime biters, whereas malaria are the nighttime biters. So these two distinguishing features is what we have seen from the bite point of view. Now, again, in malaria, what we typically see that you have a particular periodic pattern of fever which comes. So, and you get fever with chills, so which is very peculiar for malaria. So when you get fever with chills, which is lasting for more than 24 hours, you've seen that, any viral illnesses, usually your fever will come every 4 hourly, 6 hourly, 8 hourly. But in malaria, you will get it like fine 12 hours, she's completely been out of fever. So then that should, raise the antenna that no, this is the time that I need to consult my doctor because the fever is persisting for more than 48 hours and which is having a particular pattern of fever nature. So in dengue, however, you can get like an undifferentiated fever. Like if your immunity is just about okay, you may get a fever for 2 days and you may be out of it and you may not even diagnose it. Whereas if you've had the dengue for the second or third time, in fact, that is the time when dengue can have its complication because people with very good immunity, who have a past memory of this dengue infection, mount a severe response for dengue. So when you get fever beyond 3 days and there is a history of dengue in the past, and you see that in your vicinity also there has been an outbreak of dengue, you should reach to your doctor for the further consult. So what are the other general precautions that we can take to keep the monsoon diseases in check? I think the very important part is food. Here, food plays a most important role that you should eat freshly cooked vegetables, boiled water. You should definitely take a break from street food. How much ever we enjoy, having street foods, chaats and all, but this is strictly a no-no because street vendors have collected, those water and those chutneys that they prepare. We don't know how they've been covered, uncovered. Fomite spread through mosquitoes is known. So we don't want to land up with hepatitis and typhoid fever. So that's number one. Definitely avoid street food. If it's a no-no, it's the best thing that you can do for the monsoon. Part number two is drinking water is also very important. So make sure this AquaGuard is usually safe, but boiling is the gold standard. So boiled water should be consumed by infants and kids. Like till date, I consume boiled water. So that's my go-to for drinking water. Then, thirdly is hand washing. Now, needless to say, like, whenever a child goes out, he's played in dust, he's removed his shoes. First thing, he should just go to the washroom, scrub himself. Hand hygiene, we've learned it the hard way because of COVID, but that should still continue. And that is the basic before, you enjoy your food or even drinking water. So that is number one thing that we need to go with. And also very important is vaccinations. Now, yeah, our vaccinations, every time when there's an outbreak, we come up with a new vaccine. But these vaccines which are already existing, we shouldn't forget about them. So these vaccines are mainly against hepatitis A, typhoid fever, which is also very important. Influenza vaccine, which we have seen, like, this outbreak, the kids who have been vaccinated with influenza have been relatively protected as compared to the kids who have not received the vaccination. So vaccine is definitely their work because, we use in vaccines the mutated form of the virus, which is a little less harmful. So that is installed and instilled into your body, and you only make your own immunity against that virus. So whenever you are subjected to this virus which comes, your body doesn't get overwhelmed. It already has the antibodies ready, which can fight the infection a little better and can keep you relatively healthier and not get into a complicated stage. So this is what I think is what I have more or less covered from the regular general knowledge point of view. And today I'll be taking more questions. So let's see if we have any questions, Sonal. So yeah, there's so many of them. So let's take one by one. So what are the chances of getting the disease in the monsoon? So Tani Sharma is asking this question. So Tani, diseases, yes. So you're right. In this COVID also we have done our masking game, but people have still got. So, but if you're relatively careful, you're mindful about the foods that you're consuming. You're mindful when you're going for parties and all. If somebody is unwell or somebody who's not going when he's unwell is also very important. So passive participation is also many a times better. So nowadays, if you see even the schools, the teachers tell you that, okay, fine, if your child has got a hand, foot, mouth, please don't send till your doctor gives the certification. Because these diseases are known to spread by direct contact or even with the fomite spread. Like he's playing with toys in the school, the same toy is shared by the other child, then he's bound to get it. So be careful and be socially responsible by not sending your child till your doctor gives you a green signal that you're good to go. Then what are Richard's asking, what are some of the best skin care tips for the monsoon? So again, a very relevant question. So we talk of humidity. So skin care diseases also are very common in monsoon, especially kids who have eczema, with the dryness, which is there, little itchiness of the skin. So need of moisturizer increases. And the mistake that we do is we bathe, once or twice with very hot water. So you should avoid using hot water. You should use lukewarm water to tap water in consistency. And point number two, what is important in these kids is you should use moisturizer then and there on the wet skin. So basically you need to lock in this moisture and the moisture shouldn't just get evaporated. So that's important. And second thing which are very common is because of the humidity, the wetness. When the skin is little wet, then you can get fungal infections. So part of cleaning also involves drying. So make sure when you clean and give a bath to your child, you're drying up your child. When you're wearing new clothes to the child, the clothes should not be little humid and tepid. They should be absolutely dry. So it's a good idea to iron your clothes after drying so that you just whatever little moisture is there, the dry heat takes it away. So those are the common diseases. Now, hand, foot, mouth is actually not a monsoon-related illnesses, but yes, we have seen this monsoon, particularly many such outbreaks of hand, foot, mouth in daycare centers and schools. So yes, so can we get to the next question? No, I have taken this question. Can I have? So how do I get rid of disease-causing mosquitoes. So we, I think, spoke about that. Is it safe to eat salads in monsoons? Yes. So salads are one of the important reasons why you can get parasitic infections. So like worms, hookworms. So it's a good idea to, wash your vegetables, blanch them. If not, don't eat them really raw. Look for your vegetables from where you're procuring, clean it and eat them fresh. Because, there are certain cysts and eggs also of these parasites which can stay within the food. So there are these careful measures if you take, then you can stay away. Can monsoon season accelerate COVID-19 spread? So unfortunately, we've faced two monsoons in the past in COVID period, and we've said that it has not per se caused any spike in the COVID-19 infections. But this year, I think because of vaccinations, broad coverage of vaccinations, boosters being implemented, we hope that this COVID-19 doesn't flare up like the year 2021. So we are keeping our fingers crossed for that. Why are antibiotics not prescribed for common cold? So, very good question, Sneha. So, see, the common cold, by the name also common cold, if you go anywhere in the world, anywhere, pediatricians will say, like, it's normal to get about 10 to 12 colds in a year. That's practically one cold every month, which is absolutely normal. Now, it is so common and it is so viral that we don't have to use antibiotics because they will just not use. Antibiotics are used for bacterial infections. Whereas common cold is either A, because of weather changes, if you have allergic predisposition, or B, because of the change in the viral pattern, So you may get it again, like in this rainy season, 2, 3 viral colds, which is absolutely normal. You should do home remedies like consuming a lot of liquids, warm fluids, soups, stay hydrated. Taking steam is also okay. And whenever fever is definitely beyond 2 days, then it's time to reach out to your doctor. So common cold antibiotics is a no-no. And self-administered antibiotic is a big no-no. So you keep your threshold high for antibiotics for sure. You may visit your doctor twice in the span of first 24 hours for a consult, but don't give antibiotics till your doctor is really insisting to take it. Then we have more questions from Mishra Shubham. Are there any medications travelers can use to prevent for getting malaria? Yes, so there are definitely recommended malaria prophylaxis, chemoprophylaxis, which a doctor would recommend because certain medications are to be avoided in certain individuals who have G6PD deficiency. So please consult your doctor, and ideally it's known as chemoprophylaxis, which you need to start before your travel. So about a week or 2 weeks before your travel. So please get in touch before you travel. And it's always a good idea to prepare your travel well in advance before, especially if it's between two different continents, because there's a lot of weather changes and you will be taken aback by surprise where, you have to spend most of your, days in fighting the infection and recovering, because we lately have seen, especially in this monsoon, especially mother of 3, 4, the virus circulates from one child to another, and by the time one is out, it's a time to pack up and go back. So please be sure when you travel that you're going well prepared in advance. So I think we have another minute or two before we close our today's session. So we spoke about, so somebody is asking about the OPD timings at Surya and the days. So our pediatric department at Surya is functional 24/7, like literally 24 hours 7. We have a pediatrician who is there in the emergency department, and we have, doctors who are even available on the phone. So please don't hesitate to reach out to us. We have our Mumbai hotline number, which will be displayed at the end of my session. So you can please book a teleconsult or come in physically if there's anything that is required. And our pediatric department, yes, once again, letting you all know that we were awarded as number one pediatric department by the Times Health Survey 22. So feeling very proud about that. Yes, sure. So with this, I conclude my session for today, and it was pleasure having all of you all. I hope I've been able to answer most of the questions, and thank you for all the audience. Thank you. Thank you.